he said in a Truth Social post last night that he intends to push through a 100% tariff on generic drugs effective August 1st, 2028, if companies don't return manufacturing to the US. And this tariff would then be boosted to 200% a year later in 2029.
Okay, 100% to 200%, but unusually for this president, this would not start until August 2028. So that makes me think that this is all about drawing some lines in the sand and, kind of setting up a negotiation, a long-term negotiation.
I mean, the timing is interesting. Some analysts have noted that by the time the 200% tariff would, in theory, be coming through, his administration will not be in power anymore at that point, and so it would really be up to the next administration. We have seen some commentators suggesting that this would be rolled back potentially by another administration. It is, there are many challenges associated with this for the generic drug industry, partly just because, unlike makers of branded drugs, generic drug makers actually don't produce very much in the US. And that's because the US is such a low cost market for generic drugs. And it really depends on a supply chain in lower cost places for manufacturing.
Where are most generic drugs manufactured?
So the majority would be in India. It's a big place for manufacturing. Yeah.
Okay. And what I didn't know, which I found out from your reporting, generic treatments account for more than 90% of U.S. prescriptions. That is huge. Has it always been that level?
Oh, that's a good question. If it's always been that level, that I don't know. But it is at that level now. It's 90% of prescriptions, but I think something like 12% of costs. And so you can see that that disconnect. The US is an expensive market for branded drugs, as we have all discussed, so many times.
Right.
But it's actually cheaper to buy generic medicines in the US than it is in a lot of other wealthy markets.
Naomi, I thought it was interesting that you said that most of the generic drugs that we get in the U.S. are made in India. So you wonder whether this is a broadside at India overall, an attempt to just tariff imports from India. But you point out in your reporting that there's a trade pact between the U.S. and India that was struck in February, which makes a certain stipulation about generic drugs. Can you just explain what happened in February and how this threat affects that or doesn't?
So, I mean, first of all, we should say that we'll have to see how all of this plays out.
Of course.
We're discussing Truth Social posts right now, not
Official
official, policy that has gone through, lots of review and thought and discussion. So just setting that as a first point. I think this has unsettled Indian drug makers. They're very surprised by this. I guess that they're potentially, whether there would be a carve out for Indian drug makers, not sure. We'll have to see. Indian drug makers have said that for them, it's not practical to move operations to the U.S. And that to do that, they would probably have to raise prices.